Okay, I'm re-recording this because the first one didn't work for some reason. But this picture was posted by the AACN and I loved it. I shared it on my Instagram because I can literally hear the conversation that's going on between the doctor and the nurse in this photo. Being an ICU nurse, like I have seen all of this stuff. But people were asking me to explain what I wrote down here to people who are not medical or new nurses or non-ICU nurses. So I'm gonna explain it as fast as I can. So a patient is maxed on 4 pressors. Pressors are medications that keep your blood pressure up. And we walking around as humans don't need any of these, but patients that are really sick sometimes do. So maxed on 4 pressors means that we have no more room to go up on these medications. We are maxed out on them, and that's it. We have been unable to pull any fluid because of his blood pressure, so he was positive 2.5 liters last night. So this machine right there is a dialysis machine. Dialysis can clean your blood and also remove some of the extra fluid that's in your vascular system. But when patients are so sick, we can't pull that extra fluid off, and so it ends up going into their lungs, to their arms, their legs, into other parts of their body. So 2.5 liters positive last night. Think of a 2-liter bottle of soda plus another water bottle. That extra fluid is in that patient's system. We have kept him prone because PaO2 is 47. So prone means you're laying on your stomach. PaO2 is 47. That's a very low oxygen amount in the patient's blood. Very, very low. So we oxygenate better when we are on our bellies, and so the patient was unable to go onto their backs because their oxygen level was just low, and it would have dropped even more if we flipped the patient to their backs. Sats are hanging out in the high 70s to low 80s, so normal oxygen saturations for like you and I are probably 94 to 100%. So high 70s, low 80s, bad. FiO2 is 100%, PEEP 16. 100% oxygen given on the ventilator. You and I breathe about 21% oxygen. PEEP 16, this is the pressure that keeps the lung sacs that are in your lungs open. Normal PEEP is about 5. Patient got a chest tube last night for a pneumothorax. That's a collapsed lung. The chest tube went in to help expand the lung. Started bleeding from OG, so heparin's on pause. He got a unit of PRBCs for a hemoglobin of 6.2. So an OG is an oral gastric tube. It goes down into the stomach and sucks out some of the stomach contents. If blood is coming out of that, that's bad. We should not be bleeding into our stomach. So the patient had to get a unit of blood to transfuse for a hemoglobin of 6.2. We normally transfuse if a patient is less than 7, sometimes 8. PRBCs is packed red blood cells. GI was consulted but can't scope the patient because the patient won't tolerate it. So the GI doctor needs to go down with the camera, look into the stomach, find out where the bleeding is, but the patient's too unstable, so it would not make sense to go down and do this procedure. So can't do it. Patient is still a full code. Family wants all measures taken. This means that the family wants everything done despite how poor the patient is doing. Full code means they're going to do CPR, shock the patient, epi, all of those things should the patient's heart stop. But usually in this situation, a patient would not survive a code even if they did code.